What if I told you that one small change at dinner tonight could lower your blood pressure, reduce your risk of stroke, and actually help you live longer? And I'm not talking about extreme diets, marathon workouts, or cutting out everything you enjoy. In fact, one country proved that tiny changes, done consistently, can save tens of thousands of lives. Today, I'll show you exactly what they did and how you can apply the same science-backed strategies starting this week. Most people don't realize this, but a single restaurant meal often contains more sodium than your entire daily recommended intake. And sodium is sneaky. You don't taste it as salty anymore because our taste buds have adapted. But inside your body, excess sodium causes your blood vessels to stiffen, your blood volume to rise, and your blood pressure to climb silently. You may feel completely fine while damage is already happening. That's why high blood pressure is called the silent killer. It doesn't always have symptoms, but it's working against you every single second of the day. Now, here's where things get fascinating. Several decades ago, Finland had one of the highest rates of heart disease and stroke in the world. Instead of just blaming individuals and telling them to eat better, they decided to change the entire food environment. High-sodium foods were required to carry warning labels. Low-sodium, potassium-rich foods were promoted everywhere. And food manufacturers were pressured to reformulate their products without sacrificing taste. Even fast food chains like McDonald's had to lower the sodium levels in their food. The results were absolutely staggering. Over the next few decades, the average sodium intake in Finland dropped by 30%. The average systolic blood pressure dropped by 10 points. Deaths from heart attacks and strokes in middle-aged adults plummeted by up to 80%. And life expectancy increased for both men and women. Think about that. That's not a supplement. That's not a new miracle drug. That's just basic nutrition policy and understanding how our bodies work. But Finland didn't just reduce sodium. They also increased potassium. Think of potassium as sodium's natural counterbalance. While sodium tightens your blood vessels, potassium helps them relax. While sodium makes your body retain fluid, potassium helps your kidneys flush excess sodium out through your urine. It's a beautiful, natural balancing act. Studies show that simply increasing potassium-rich foods can lower systolic blood pressure by 5 to 7 points. And these are delicious foods we're talking about, like bananas, oranges, sweet potatoes, spinach, and beans and lentils. Now, an important reminder, potassium supplements are not for everyone, especially if you have kidney disease or take certain medications. So always talk to your doctor before making any major changes or adding supplements. For years, we all thought cardio was the absolute king for blood pressure. But a large 2023 meta-analysis published in the British Medical Journal reviewed 270 clinical trials and found something unexpected. The most effective exercises were actually isometric exercises. These are things like wall sits, static squats, and planks exercises where you hold a position under tension. The study found these exercises lowered systolic blood pressure by up to 8 points on average. Now, if you love doing planks, that's great. But here's the key message. Any movement is better than no movement. High intensity, low intensity, strength training, walking, they all help. The best exercise is simply the one you'll actually keep doing. Weight loss is another powerful lever you can pull. For every 1 kilogram, that's about 2.2 pounds that you lose, your blood pressure can drop by about 1 point. This adds up very quickly. Alcohol is a bit trickier. It feels relaxing at the moment, but drinking more than 2 drinks per day actually raises your blood pressure over time. And smoking, there's just no way around this one. Nicotine spikes your blood pressure immediately and damages the lining of your blood vessels long term, making them stiff and narrow. When it comes to your blood pressure, there is simply no safe amount of smoking. Sleep matters far more than most people think. Sleeping less than 6 hours per night significantly increases your risk of developing high blood pressure. But some people sleep all night and still feel exhausted during the day. That can be a sign of obstructive sleep apnea, a major and often overlooked cause of treatment-resistant hypertension. If you snore loudly, wake up gasping for air, or feel excessively tired despite getting a full night's sleep, that's a very good reason to talk to your doctor. Then there's stress. Acute stress, like before a big presentation, can temporarily raise your blood pressure. But chronic, long-term stress affects your blood pressure mostly through our coping behaviors. Making poor food choices, drinking too much, smoking, and being inactive. Learning healthy ways to manage stress is one of the most underrated interventions for heart health. And here's a fun one. Studies show that people who own pets, especially dogs, tend to have lower blood pressure. One small study even suggested the effect could rival some blood pressure medications. So, how low should your blood pressure actually go? The landmark SPRINT trial compared to blood pressure targets, a standard target of 140 systolic versus a lower target of 120 systolic. The group aiming for the lower target had 25% fewer heart attacks and strokes, and a 27% lower risk of death from any cause. It did come with more side effects for some, like dizziness and kidney strain, which is why individual targets should always be discussed with your doctor. But this study is a big reason why guidelines now define hypertension as starting at 130/80. You don't need to do everything at once. Sustainable change always beats perfection. Pick just one thing from today's video and commit to it. Maybe it's adding a banana to your breakfast, swapping one salty snack for some nuts, or doing a wall sit for 1 minute a day. Tell me in the comments what you're choosing. That's your commitment. High blood pressure affects over 1 billion people worldwide. By sharing knowledge, we can change that. If you found this helpful, share it with someone you care about, and I'll see you in the next video.